Well, there are two reasons why non-medicinal approaches really haven't been looked at in this age group. One is that it's fairly tricky to identify ADHD at an early age. Most young kids are very active and don't have long attention spans and may behave impulsively. And so separating out those kids that have ADHD versus those that don't has been challenging. I think that we've enhanced that assessment process over the last decade or so that we can reliably identify them. But that, I think, accounts for some of the reasons why this population hasn't been looked at. The other is that, quite frankly, medicine's easier than the intervention approaches that we attempted in this study. Medicine doesn't require parents to change how they interact with their kids. Medicine doesn't require teachers to modify their classroom or to address the difficulties that the child may have head on. So what we're asking parents and teachers to do is much more difficult on a day-to-day basis for them to do than to administer a pill once or twice a day. And so for that reason, I think people have looked at, for lack of a better way of putting it, the easy way first, which is to try the medicine. And you know, unfortunately, that hasn't worked for a lot of kids. It has worked for some. And but what we want to do is try to identify what can we do beyond medication or in lieu of medication for these young kids. But again, it's going to require parents and teachers digging in and doing some work.